Welcome everyone. My name is Megan Partyka and I'm presenting local and systemic antibiotic levels of subcutaneously implanted Florfenicol calcium sulfate beads in New Zealand white rabbits. I'm sure many of you in this room are aware how common abscesses are in rabbits, and they can be very frustrating cases as well. They can present subcutaneously from trauma or be associated with complicated dental or otic infections that can progress to osteomyelitis. The bacteria that have been isolated from rabbit abscesses in previous studies often involve mixed infections of aerobic, anaerobic, gram-positive, and gram-negative bacteria. Rabbit abscesses are also very difficult to treat, as we know simply lancing and flushing is not effective in rabbits. Cases often require surgical debridement, and follow-up procedures are common due to the high recurrence rate. Packing the surgical site with antibiotic beads enables us to achieve high localized antibiotic levels, which can be difficult to achieve by other methods. Historically, polymethyl methacrylate or PMMA beads have been used. Calcium sulfate beads, on the other hand, offer advantages. They're biodegradable and absorbed by the body. That eliminates the need for another surgical procedure to remove them. They also provide an osteoconductive matrix that's going to help restore and remodel the bone. Various types of calcium sulfate beads and brands have been used with different types of antibiotics in vivo in multiple species in past studies. The calcium sulfate carrier kit, as seen in that top right, that's been analyzed to be comparable and in some cases superior to the calcium sulfate in many of these previous studies. The beads are medical grade. They have multiple benefits. They're high purity, non-toxic, fully absorbable, lab tested safe for animal implantation, and gamma radiation sterilized. They have been evaluated in dogs and cats, but not yet rabbits. So we elected to mix the carrier calcium sulfate beads with a broad spectrum antibiotic, and we chose Florfenicol. This antibiotic has been safely administered to rabbits IV, IM, orally, and no reported adverse effects have been seen with these various routes. This antibiotic may be effective for the broad range of bacteria that we know are involved in rabbit abscesses, as it's active against gram-positive, gram-negative, aerobic, and anaerobic bacteria. Ideally, of course, your antibiotic choice should be based on your culture and sensitivity of the abscess. However, realistically, we may not always have this information in clinical practice, whether that's from financial restrictions, not having those results by the time of surgery, difficulty in culturing certain bacteria, such as your anaerobes. So Florfenicol also has greater antimicrobial activity than chloramphenicol, and chloramphenicol has been shown to be effective against bacteria that have been isolated from rabbit abscesses in the past. Florfenicol also does not carry that risk of inducing drug-related aplastic anemia in humans that we have with chloramphenicol. For Florfenicol MICs for bacteria specifically isolated from rabbits or rabbit abscesses, we don't know that data. The MIC data does support a high efficacy of 2 micrograms per mil Florfenicol against most bacteria in other species, though. So, these characteristics suggest Florfenicol is a safe and effective choice for abscess treatment in rabbits. So this study evaluated local and systemic antibiotic levels using these subcutaneously implanted Florfenicol calcium sulfate carrier beads in New Zealand white rabbits. And this was to determine potential for future clinical use for treating them in practice. Our first objective was to determine the presence and duration of local tissue antibiotic levels. We hypothesized that they would remain high. And the second objective was to assess the safety of using these Florfenicol calcium sulfate beads. And we hypothesized that there would be no significant systemic antibiotic concentrations or adverse local or systemic effects. This study was IACUC approved using 8 healthy female juvenile New Zealand white rabbits. The research was conducted prior to a terminal use in an endoscopy teaching lab and was concurrent with another sedation research study. So to prepare the beads, the carrier calcium sulfate kit, as seen here, can be used to make 2 different size beads and mixed with the veterinarian's chosen antibiotic. Different mixing instructions and set times are provided, And the Florfenicol calcium sulfate beads we prepared at the larger 5 millimeter diameter size using the non-standard liquid mixing instructions with 600 milligrams of Florfenicol solution. We used 10 calcium sulfate beads subcutaneously in each rabbit, so that was estimated to be about 4.76 milligrams Florfenicol per bead and about 47.6 milligrams per rabbit. We also prepared some calcium sulfate beads without antibiotic to be used in one control rabbit. The procedures were all performed on that first day under general anesthesia. The rabbits were pre-medded with midazolam and ketamine and maintained on isoflurane gas using a V-gel. Local anesthesia with lidocaine was used at the incision, and we did monitor the rabbits routinely. 2 of the rabbits unfortunately did die under anesthesia prior to the calcium sulfate bead placement. We were placing jugular central IV catheters, and one of these deaths was associated with catheter placement, which did prove to be difficult and unsuccessful in all of the rabbits. For the surgery, the area in the right craniolateral dorsum was clipped and aseptically prepped, a skin incision was made, and the ultrafiltration probe was implanted subcutaneously using the manufacturer instructions and a provided trocar. And then the tubing from the probe was exteriorized through a smaller skin incision cranially. We placed the 10 calcium sulfate beads subcutaneously alongside the probing, and then the skin was closed. We then attached the vacutainer to the vacuum vial needle holder as instructed in the kit. And then we also secured the apparatus to the animals using some sutured tape tabs and provided some vet wrap and stockinette and e-collars. Rabbits were monitored until fully recovered and provided oral meloxicam once a week. So after the procedures, we started collecting blood at hours 3, 6, 12, 24, and 48, and day 7, 14, and 21 post-bead placement, either through the jugular catheter if present or peripheral vein. And blood was also collected at the beginning and end of the study for hematology and a select biochemistry panel. That was to evaluate systemic health. Interstitial fluid sampling was performed via that ultrafiltration probe kit. This is seen on the right there. So this device has been used in numerous species, including rabbits. The ultrafiltration extracts fluid from the extracellular space of tissue and allows continuous sampling in awake animals. So the probe consists of loops of hollow dialysis fibers that are placed within the subcutaneous tissue and then connected to a single non-permeable conducting tube that's brought to the surface of the body and into a vacutainer collecting tube. So this allows passage of low molecular weight compounds and yields 100% recovery of an analyte without dilution. The interstitial fluid was collected daily for 21 days by removing and replacing a new vacutainer. The plasma and interstitial fluid samples were then analyzed for Florfenicol concentrations by a high-performance liquid chromatography with ultraviolet detection developed for this study, and then pharmacokinetic analysis was performed. So we were able to successfully collect a total of 31 plasma and 61 interstitial fluid samples over the course of the 21 days. As you'll see, all parameters were higher in the interstitial fluid compared to the plasma as we predicted and hoped to find. And we did observe a long half-life in that interstitial fluid. So the mean area under the curve was 16 for plasma and 17,616 for interstitial fluid. The mean maximum concentration was 0.83 micrograms per mil for plasma and 245 micrograms per mil for interstitial fluid. Mean time to max concentration was 2.9 hours for plasma and 59 plus or minus 40 hours for interstitial fluid. The mean disappearance half-life was 30 plus or minus 16 hours for plasma and 27 plus or minus about 9 hours for interstitial fluid. The mean residence time was 40 plus or minus 15 hours for the plasma and 73 plus or minus 16 hours for interstitial fluid. all parameters, like I mentioned, were higher in interstitial fluid. So looking over our plasma florfenicol concentrations, as you can see on the bottom of this image, the overall florfenicol plasma concentrations remained low. Highest concentrations we found were detected at that first time point of 3 hours post-bead placement. We were getting values of 1.2, 0.7, 0.44 micrograms per mil. The plasma concentrations did gradually decrease over time over the next 48 hours and remained below 0.6 microgram per mil. On day 7, plasma concentrations were lowest, and that was only found in 2 rabbits. One was at 0.14 and one at 0.02 micrograms per mil, and then they were not detected in 3 rabbits. No florfenicol was detected in plasma samples on day 14 or 21, or in any control time 0 or the control rabbit plasma samples. And for our interstitial fluid florfenicol concentrations, as you can see on the top of this image, we were happy to find overall high local concentrations in the interstitial fluid. The concentrations were highest in that first 4 days after a bead placement. And we did have a relatively large range between the rabbits. One got up to 65 micrograms per liter, another all the way up to 638 micrograms per liter. Those concentrations fell below that predetermined cutoff of 2 micrograms per mil at some time between 7 and 14 days. So each rabbit reached that point where they fell below at day 8 for one, day 9 for another, day 11, and then day 13 for the last. And those interstitial fluid florfenicol concentrations did generally decrease over time. However, there were some fluctuations with spikes of higher concentrations observed, which is better appreciated on this log scale here on the left side. And that could be related to the fluctuation in the interstitial fluid volumes we were producing with the probe collection, or from changes based on how those beads were breaking down. The interstitial fluid collection also ended at various time points due to some complications. So sampling ended on day 5 in 2 of the rabbits, one of which was the control. Day 13, day 15, 18, and 21 in each remaining rabbit. So the one rabbit that we had sampled on day 21 did still have florfenicol concentrations, although they were low at 0.57 micrograms per mil. Looking at our ClinPath data, we unfortunately didn't have pre and post samples available for each of the rabbits, so that did limit us comparing and doing statistics, but hematology results overall were unremarkable. There were some variations and differentials between the rabbits, but there weren't any clinical concerns. The biochemistry results were overall unremarkable, and it did include total protein, BUN, creatinine, glucose, calcium, phosphorus, AST, ALT, and total bilirubin. CPK variably was elevated in all samples. That was not associated with the sampling date. So we did have some limitations and complications more than anticipated in this study. We were limited by our small sample size. We initially had a small number of rabbits, and then unfortunately we did lose 3. So as I mentioned before, 2 of those deaths were on that initial anesthesia prior to the bead placement. One was attributed to catheter placement complications, as a atrial tear was confirmed on necropsy. The other was attributed to a mild interstitial pneumonia of unknown origin and myocardial degeneration, which was suggestive of a systemic acute phase response, but no infectious organisms were identified in the lung samples. The third death was on day 9, and that was acute and attributed to changes in the brain, which were a focal neuronal necrosis of the hippocampus and lung, which had arteritis, vasculitis, hemorrhage, and edema, and unfortunately no specific cause was determined. Lack of sampling time points was another problem, both from the jugular catheters and from the filtration probes. The catheter placement proved difficult, so we did elect not to place them in all of the rabbits after the associated deaths, so that limited us getting each of those time points for the systemic blood collection. We also had that variable daily production of the interstitial fluid collected by the vacutainers, so we didn't have enough volume to run analysis on each day for each rabbit. The probe tubing was also damaged, so that prevented further collection in 2 of the rabbits, one during the 2nd week and one during the 3rd week of the study. And that was from the rabbits biting through this very thin, delicate tubing, which we hoped they couldn't reach on their back in that inner scapular area. And despite adding additional protection and vests and e-collars, they still managed to outsmart us. So we had that as a complication as well. Gross necropsy was performed on day 26 post-euthanasia in the 5 remaining rabbits. This revealed that the beads had not yet fully dissolved, so there was a breakdown into a kind of thicker, soft white material that was present around the probes. No other gross lesions were identified. Histopathology was performed on selected tissues, including liver, kidney, and that subcutaneous tissue around the site of the probe and the beads. For all of the rabbits, the experimental treatment tissue site contained granulation tissue, collagen, and fibrosis, likely representing the healing process and response. These sites also contained evidence of variably severe foreign body macrophage response and mineral, which is likely attributed to the beads. Tissue response appeared fairly consistent between the rabbits, aside from one rabbit which had some extensive eosinophilic and macrophage response. Hypersensitivity, drug response, or other immune-mediated responses could be considered for this. 4 rabbits had very rare eosinophils as part of the inflammatory response, which may represent a more normal immune response. Subcutaneous edema was present for all of the rabbits, but the significance is unclear. This may just represent collection artifact or be related to inflammation. There were no significant microscopic findings in the liver and kidney sections in any of the rabbits. Some most likely physiological changes in the liver were present, but were not severe enough to be anything suggestive of toxicity or metabolic disease. So in conclusion, subcutaneous florfenicol calcium sulfate carrier beads in New Zealand white rabbits achieved high interstitial fluid local antibiotic concentrations, considered effective against most bacteria using that MIC cutoff of 2 micrograms per mil for at least 7 days and up to 12, while maintaining low plasma concentrations. Our highest interstitial fluid concentrations were observed in the first 4 days. Florfenicol was still detectable at low concentrations in interstitial fluid at day 21 in 1 rabbit, and that was the only sample we had at that time point. Plasma, it was still detectable at day 7 in 2 out of the 4 rabbits, albeit at low concentrations. No significant adverse effects were attributed to the florfenicol calcium sulfate beads. There was no significant ClinPath or histopath changes to the kidney or liver, but we did see local soft tissue inflammatory changes. And the beads were noted to not yet be dissolved at that time point of 21 days. So this study gives a lot of jump-off points from the information we found. Of course, it would have been great to have a larger sample size, have longer time points, looking at different numbers of calcium sulfate beads, looking at its use in different locations, assessing the efficacy in some real rabbit abscess cases would be the next great step as well. And playing around with comparing florfenicol to other antibiotics for the beads, or looking at this in other species as well. So there's a lot of great directions that we can take this information and continue this work. I'd like to say thank you to Carrier and the UGA Veterinary Teaching Hospital, Small Animal Medicine and Surgery Department for funding this research, and to the many colleagues listed here who made this research possible. References are listed here. And I'd like to say thank you to all of you here for your attention and attendance. I hope you found this information interesting. I wish, of course, I could be there in person to speak with you and answer some questions, but please feel free to reach out to me. My email address is on the screen here, and I hope you all enjoy the rest of your day and have a great conference.